This is Chris Kell with just a quick tutorial on proper standing stance and how we can make some quick adjustments to our stance to shift the weight into our butt and hips and take pressure off of our knees and our low back. And a couple things when you're looking at my stance here, and what you'll see is that I'm leaning forward right now. Okay, you can see that my toes are kind of gripping down, and I can zoom in a little bit to show you what I mean. My toes are kind of pressing down here into the ground, whereas when I lean back, I'm able to lift my toes off the ground. Okay, and this is the first thing that we commonly see with many people is a forward weight shifting. Okay, so in this position, we stand here all day. We walk forward, we sit in a hip flex position where our knees are bent, and we kind of load this position all day. Okay, and for those that experience things like hammer toes and pain in the front of their feet, this is one of the reasons why, because we're slightly shifted forward onto our toes all day. So if I fall, I'm going to fall forward. So the first correction that we want to make is I tell people to shift your weight back on your heels and try to stand with the majority of your weight in your heel and to a lesser degree your midfoot. Okay, and what you should be able to do is lift your toes up. I say to people, you know, if you're going to fall, you should fall backwards. Okay, and that's the biggest thing. We don't want anybody to fall, but that's the point. Okay, the next thing we often see is this pronation effect, where again, my feet are pronating in, you know, there's this internal rotation moment, and I stand with my feet very, very close together, okay? So what I want you to think about doing, rather than kind of, and you know, this is one of the causes of flat feet and things of that nature. So what I want you to think about doing is rolling your feet out to the side, okay? When we do that, we start to use more of our lateral hip muscles, and we start to distribute the weight on the outside of our thighs versus constantly loading the inside of our knees. Okay, so that would be the next step. It's just rather than letting your feet collapse in, just to think, roll your feet out. Okay, next cue. Third and final cue is when we look at kind of the kneecaps here, you kind of see them standing very close together, and this is how many of my female clients stand. Feet are very close together, you know, and what this does is it puts a lot of rotational torque on the knee joint, okay, because things are close together. It contributes to this idea of bowing in. So what I want you to think about doing is just walk your feet out about 2 steps. Your feet should be either in line with your hips or a little bit wider, okay, and this might seem a little bit funny at first, but this is what we're looking for here, because this is going to once again distribute the weight a lot better to your hips versus your knees. Okay, so this is a big cue right here. So just in summary, our 4 points. Okay, first and foremost, sit back on your heels. Think about shifting your weight into the balls of your foot. Okay, you should be able to kind of feel more weight in your butt and your hamstring versus the front of the knee or the front of the legs. Okay, and that's going to give your knees a break. You should be able to wiggle your toes up. Okay, and that's going to give you some, again, breathing room, and one of the best exercises to tone your butt possible. All right, the next cue is roll your feet out to some degree. This is going to counter kind of the feet collapsing in, and this is going to help to shift the weight into our lateral hip muscles. Third cue, widen your stance. All right, so the wider I am, not necessarily very, very wide, but maybe just take 2 steps out, we're going to distribute the weight a lot better into our hips. We're going to take a lot of pressure off of our low back. Okay, and a bonus one as well is that, you know, there's a lot of controversy about whether I should stand with my knees bent or my legs straight. Okay, and the answer is we want to keep our legs straight, but what you should be able to do is wiggle your kneecaps up and down. And you can see this when I'm standing, I can kind of move my kneecap up and down with my quad. What happens for a lot of people is that when we stand in hyperextension, meaning we lock our legs out so much, our quad becomes really overactive and locks our knee in position. So you should be able to flex your kneecap up and down. I can't really do it that well in this picture, but you can kind of see your patella moving up and down when I flex my quad muscle. And if that's too much, then that means that we have our knees actually a little bit too locked out, what we call hyperextended. So just soften your stance just about a degree or 2, and that'll take a lot of pressure off of your knees also. So that's what we're looking at. Those are our stance cues. You know, either work them one at a time or, you know, practice them during your day and standing, and that's our video.